The Gates Foundation will be making a significant commitment ourselves, a commitment of $2.1 billion over the next 5 years into several significant economic, social investments and a new program on women in leadership. And we're looking for other partners actually to do the same. There has been some progress that we need to pay attention to, but also really a call to action that, especially in the context of this pandemic, which has highlighted again how women have disproportionately borne the brunt of the economic and social impact.
These funds will focus economic empowerment, family planning and health, and also accelerating leadership. Why was it important to do so and focus specifically on these three areas?
We have a long tradition of work in family planning and support around women's health, and so that is a particular area where we see great needs, because again, that's an area that has seen a drop-off in access to family planning during the course of the pandemic over the last year, and a rise in unplanned pregnancies. We have investments in new technologies that will make hopefully family planning more accessible, easier to use, safer. Women's economic empowerment, we've seen time and time again, when women get access to financial resources, whether it's access into bank accounts, to savings, training through what we call women's economic empowerment collectives, which are often called self-help groups, access to social payments from governments, they will tend to use those resources highly effectively, both for themselves but also their families, investing in their children. And then last, women are just very underrepresented in global leadership still. That is probably the biggest indictment after 25 years after Beijing.
What lessons have been learned in the process, and to what extent have these lessons shifted the work of the foundation?
One of the most important lessons, how do we make sure we are actually listening to the voices of the people on the ground, the women who have the need, that what is holding them back? What are the challenges in their households? What are the challenges in their communities? What do they most look for in a family planning product? The second is being actually more thoughtful about the sets of partnerships, whether it's with United Nations agencies, whether it's with national governments. National governments, say particularly across Africa, have historically given very little resources into family planning directly. After 2012, there was a shift in that, and a number of countries like Kenya and others we've worked with have changed that and have started to make this more systematic. But we think that's something that we should need to build on and grow, and actually have partners in the government see that as a critical set of priorities.
The Gates Foundation released a new data that show pandemic-driven inequality is growing at an alarming pace. What were some of the key findings?
One of the most important ones has been the hit on women's employment. Even though at this stage there's almost been a full recovery in male employment globally, there are still 13 million women lost their jobs that have not regained their jobs. That's a huge gap, and that's why governments really need to focus and engage much more deeply on that.
How can we really shift these disparities in the workforce in the long run?
One other key area that part of our investments is going to come in is in childcare. That we know that women disproportionately tend to have the childcare burden, because we've had women having to spend up to 8 or 9 hours a day looking after children, particularly with schools closed and other challenges. And so a more systematic response that has governments and others providing support and institutional support.
How can governments and leaders locally contribute?
We need to see governments, I believe, some leaders, President Kenyatta will be in Paris, I think, and others making some commitments. What are the investments? What are the metrics that we're going to use so that citizens can hold their own governments accountable for making the engagement and the follow-up? This time we hope, and it's not just governments, it needs to be civil society, it needs to be the private sector engagements, but our hope is that this is an event that is going to have rigorous follow-up. There are core metrics. Are there more women in parliament? Are there more women in government? Are there more women in senior healthcare positions? Are there more women in senior economic development positions? If they're not, we need to redouble those efforts.
What else is on the agenda for the Bill and Melinda Gates Foundation?
But in the short term, we're also still very, very focused on the COVID response, because this is a crisis that is not yet over. It's been very inequitable in terms of the rollout of vaccines, going disproportionately to the rich world and not the poor world, where only 1% of Africans are currently vaccinated. And we need to confront this crisis first in order to be able to lay the platform for these wider rebuilding in the gender equality and agricultural development in other areas like health and financial inclusion. We're trying to focus on all of that, but the central message is keeping gender at the heart of it and women's equality at the heart of it is the key way to get long-term success in all of these areas.
The message is clear. Mark Suzman, thank you so much. We appreciate your time.
Great. Thank you.